Hello to everyone who's joining. We're going to wait a couple of minutes to make sure we have enough time for folks to log on. Welcome to everyone joining us today. I'm Michelle Freund, Director of Strategic Data Initiatives at the Child Mind Institute. We appreciate your interest in the topic and hope that today's discussion will be stimulating and lead to additional engagement. We'd like to extend a special acknowledgement to the California Department of Healthcare Services for their partnership in making this event possible. The Child Mind Institute's Technology and Youth Mental Health webinar series brings together researchers, advocates, and tech thinkers to explore crucial questions around the relationship of technology use, including social media, and mental health. We are especially interested in understanding how can we advance research on this relationship using real-world data. Dates for future webinars in this series will be announced on the Child Mind Institute website as soon as they're finalized. We welcome questions from the audience for our panel members, but please use the Q&A function on Zoom. We will entertain as many of them as we can today, but we'll also post a list of questions and responses on the website as soon as they can be addressed. We will also email a link to the recording for all of the registered participants, and it will be available at a later date on the website. So again, I'd like to thank you for joining us today, and I'd like to kick off this webinar series on technology and youth mental health with this discussion specifically about ecological data and the next frontier of mental health research. We hear from a lot of parents that technology use is one of their biggest concerns with respect to their children's well-being. There is general worry, supported by observable data, that the pervasiveness of technology and social media exposure may be playing a role in the increasing prevalence of anxiety and depression among our teenagers. At the same time, I think we would all acknowledge that we can't put the genie back in the bottle, and that technology can play a central role in how we support and care for our kids, including the ones struggling with mental health concerns. However, there is an inherent conflict in trying to understand the impact of technology on our kids' mental health. We may very well have to use that technology in order to study its effects. And in fact, many clinicians in schools across the country are experimenting with a range of technology-based interventions to help kids through tough times. Experimentation is great, and we also must recognize that we don't know what effect technology is having for different populations. And we don't know which interventions will be effective. We need a research revolution if we're to make progress here. CMI is a clinical and a research organization, and we believe a research revolution is needed to tackle the youth mental health crisis facing this country. Research can play a critical role in closing at least 3 gaps in our current knowledge. What impact does technology have on youth mental health? How do policymakers, parents, and clinicians determine which technology-based interventions are having a positive effect on this mental health crisis? And how best and to whom can we direct those interventions for the highest impact? We need more and better data to fill these gaps. The way we analyze and study mental health historically has largely been based on retrospective self-assessments offered by a patient, often in a clinical setting. And our research has been based on a lot of survey data and data collected in the clinic, not data reflecting the real-time and real-world experience of patients. But we recognize that symptoms vary across timeframes, whether hours, days, or months. And snapshot data, such as that provided by these surveys, relying on accurate recall, often misses the overall clinical picture. Introduction of measurements like ecological momentary assessments hold tremendous potential for providing a more robust picture of an individual's mental health and for connecting variations in mood to specific behaviors over time. Combined with data that reflect a person's use patterns of technology products, this information offers tremendous research potential. Incorporating these data into our research is complex and elicits many questions around ethics, privacy, and data sharing. But before we can fully investigate those issues, we first want to unpack why ecological data are so important for researchers to gain access to. What types of research questions cannot be answered given today's data limitations? What sorts of questions can we answer with more robust ecological data? So each of our speakers on the panel today brings their own expertise and lens to these questions. So I'd like to get started by allowing each of them to briefly introduce themselves and the work that they're engaged in. Our first speaker today will be Dr. Kathleen Marikangas from NIMH. Kathleen?
Hi, everybody. Turns out I'm in Austin, Texas, which is an hour behind all of you. So I'm glad I could make it on time for this talk. I'm actually at the Society for Research in Biologic Psychiatry, where we're hearing of some of the latest advances in our understanding of physical and mental health in both adults and youth. So I wanted to start out to talk about what ecological momentary assessment is and its history and context in child psychiatry. Measurement in child psychiatry, as Dr. Freund just said, is complicated because we don't have laboratory tests or x-rays that we can do to make diagnoses. What we really have to collect information on is people's subjective response to their environments. And that's a very complicated process, particularly when the conditions we study, and that would be mood, anxiety, attention, and so forth, they vary by minute to hours to days, as you just mentioned. And it's very hard to capture that with our traditional tools, checklists and interviews that rely on other people's words for describing the experiences of people. So ecological momentary assessment really began about 30 years ago when people realized it was very important to capture these kinds of data in understanding situations such as craving for smoking. That's when this work really began, where they started to use paper and pencil methods to survey people up to 7 or 8 times a day to characterize their mood and their affective states. And since then, the field has really progressed through personal digital assistants used in the early 2000s to the current time when we had very sophisticated technology with smartphones, starting with mobile phones and smartphones, where we can really, it makes it much more feasible and less burdensome than it did when we started this work out, where people had to carry around questionnaires with them and answer the questions. And then the data are actually entered by hand into computers, not allowing us to really to capitalize on the important data that were emerging. So ecological momentary assessment has started to be very widely used in a number of fields in both physical and mental health. It's been primarily used in children to study mood disorders, substance abuse, and attention. And it's been used in adults for the full range of mental disorders, ranging from severe psychosis to substance abuse to people who suffer from bipolar disorder and so forth. And more recently, ecological assessments have been used to study sleep, physical activity, and a number of different health conditions as well. So at the Child Mind Institute, I've been working with the Healthy Brain Network in partnership with the National Institute of Mental Health Intramural Research Program, where I am an investigator. We've been working to pilot these tools in youth to gain some sense of their input on the questions we ask, but also to see how much burden there is and what is the balance between the burden and the information gleaned from these tools. So we've recently finished a study of about 30 youth where we followed them for 1 year using the ecological tools that we've been developing at the National Institute of Mental Health. So I wanted to just make a couple other points about this to frame the discussion for today. And that is, what have we learned and what can we learn in the future? And what are the experiences of the other panelists so that we can begin to put together these tools, think about how we harmonize the methods, and confront the challenges with the complex data that are derived from these momentary assessments that are necessarily prospective, multi-level, and both within individual and their cultures. So the 3 points that I think are most important about the use of these tools in combination with traditional tools are, one, we can capture people's daily experience. So we can capture their mood, their emotions, their behavior, and that can range into pain, physical symptoms as well. So we can capture that in real time. Secondly, we can collect information on what drives those systems. What happens in their lives? What about stressors? What about events in their lives that may lead to changes in their baselines in any of these domains that we study? Third, we can also start to use them for prediction, because once we have the ordinal relationships between determinants of these changes in mood, energy, activity, and so forth, we may be able to use these tools to build in interventions that may prevent negative consequences of those events in people's lives. And finally, we may be able to look across the global world in looking at broader environmental changes in temperature, climate, the stress of the environment, things like COVID, where we can look at higher level determinants of changes in these systems at the individual level. So I think that these tools, when coupled with other tools such as physical activity monitors, with heart rate variability, and with biologic measures, which we've now been collecting, I think these tools may enable us to get a fuller picture of the scope of all the determinants of these conditions that can lead to disturbances in mood, energy, attention, and so forth, which are the main goals of some of the work that we're doing at the Child Mind Institute.
Wonderful. Thank you. Thank you, Kathleen. I'm now going to turn it over for a brief introduction to Dr. Michael Milham from the Child Mind Institute.
Okay, thank you. I can speak to this opportunity both as a child and adolescent psychiatrist and as a brain imaging researcher focused on mental health and learning. I believe the collection of real-world data, also known as ecological data, is essential for advancing our understanding and treatment of mental health issues in youth. Real-world data collection, which captures the dynamic interplay between individuals and their environments, including technology, offers several transformative advantages for mental health research and practice. First, real-world data enhances the reliability of behavioral measurements. By observing behaviors across multiple real-world settings, we can obtain a more comprehensive and accurate picture of an individual's mental health, avoiding biases often present in laboratory settings or single environment observations. This multi-setting approach allows a more nuanced understanding of how behavior changes and manifests in different contexts, which is crucial for accurate diagnosis and treatment. Second, real-world data enables us to capture the natural fluctuations in both behavioral and physiologic responses. These variations are immensely informative for detecting mental illnesses and understanding their progression. Such data can reveal patterns that would likely remain undetected through traditional methods that often provide only static cross-sectional insights. Third, the granularity of real-world data collection facilitates monitoring responses to interventions with unprecedented resolution. It also allows for real-time continuous assessment and adjustment of treatments based on immediate feedback from the patient's environment and condition. This capability is particularly revolutionary, offering the potential to move from reactive to proactive and personalized mental health care. Last, the integration of sensor-based technologies and data collection addresses the urgent need to understand how youth interact with social media and digital technology, context uniquely relevant to the current mental health crises. Unlike traditional self-report or parent report measures, sensor-based data collection provides objective, precise, and less intrusive insights into how these interactions affect mental health. In summary, I'd say that real-world data collection promises to refine our strategies for intervention, enhance the accuracy of our assessments, and ultimately improve the outcomes for young people navigating the complexity of today's digital world.
Thank you, Mike. And our next panelist is Dr. Gaia Dowling from the National Institutes of Health. Gaia.
Hi, thank you, Michelle. I'm Gaia Dowling. I'm the director of the Adolescent Brain Cognitive Development Study, or the ABCD study, at the National Institutes of Health. ABCD is a large longitudinal study of brain development and child and adolescent health enrolling nearly 12,000 youth when they were 9 to 10 years old and assessing them repeatedly for a decade. We're collecting a broad array of data, including brain imaging, neurocognitive testing, biospecimens, and survey data related to physical and mental health, substance use, and culture and environment. In addition, we collect objective Fitbit data and cell phone use data, as well as residential history-derived environmental and policy data. We began when the youth were 9 to 10 years old because we wanted to collect data prior to the onset of most mental health conditions and continue through the period of highest risk. Because we know to understand the factors that contribute to mental health, it's important to get a comprehensive picture of the environment in which youth live. Studying one aspect of their lives, such as social media use, for example, without contextualizing information makes it difficult to know what and how it may be impacting them. To do so, we need to collect data from a wide variety of sources. Some data needs to be collected in person, such as brain imaging, but others, such as ecological data, allow us to collect more in-depth and time-relevant information that can then be combined with the other data that we collect to get a more comprehensive picture of mental health.
Thank you, Gaia. And our next speaker is Dr. Linda Charmaraman from Wellesley College. Linda.
Thank you so much, Michelle. I am Linda Charmaraman, just as she said, and I'm from Wellesley College, director and founder of the Youth Media and Wellbeing Research Lab. And back when I was applying for grants to try to create a new data set of the topics that are near and dear to my heart, there weren't any national longitudinal data sets that aimed at the things that I wanted to study. A lot of the main adolescent health, data sets would have a very, very broad sweeping constructs about screen time use, for instance, but not really so much about specific use in terms of, texting versus gaming versus social media and which platforms and, all the nuances. And so I went about and tried to get my own funding through NIH to start up a prospective study of middle schoolers into high school, starting at around age 10. And I think we kind of started around the same time, like in 2018. And in terms of our data set, we're definitely small fish compared to ABCD study, of course. We also really aim to collect data from a non-clinical population, community-based, school-based, so the people that took the survey really reflected the communities that we were, investigating. And we were trying to get away from self-selection issues from other studies where only certain people, are the ones that actually get to do an EMA study because of, involved parents or, all kinds of other issues. And so we were hoping also during that time to increase the field's, ability to analyze very specific types of social technology use rather than kind of look at another data set that wasn't focused on social technology use and have findings from a large data set that didn't focus on it. And so our data set focuses squarely on social technology and mental health use. And so that's the history of how I came to drive my data set.
Great, thank you. That's great. We're going to have very different perspectives. We can talk about the difference of those two studies. And our final panel member is Dr. Satra Ghosh from MIT. Satra.
Thank you, Michelle, and thank you to the CMI for organizing this. I'm the director of Open Data and Neuroscience Initiative and a principal research scientist at MIT. And our group largely focuses on one of these ecological streams, our own voice. You're listening to me right now. I'm listening to everybody speaking over here, not maybe everybody in the audience, but everybody on the panel. And it conveys a lot of information. And over the years, we've tried to understand what kinds of information it conveys, how we come to produce it, how it changes over the lifespan, and how we might use it as an insight into our own mind. But as we have investigated the space of voice, we've realized that it just doesn't sit alone. We can investigate it in the context of brain imaging, in the context of mental health. And over the last decade or so, we've gotten in squarely into this space of trying to understand how these different kinds of sensors and information spaces help us paint a better picture of ourselves. Can we understand ourselves and our future states better through the lens of these different sensor technologies? We have continued to focus very much so in the context of voice, text, which are very easily available and scalable, and then look at it through the more finer lens of brain imaging, because we can't do that at scale on everybody, every day, everywhere. So we need to have different methods and mechanisms to kind of bring data from people in their ecological settings, as opposed to the laboratory settings where we have largely collected a lot of data sets. And this change of context actually plays a significant role in how we evaluate each individual. To do so, we need good tools and techniques. So another part of our lab kind of focuses on how we can develop robust processing methods for these different types of data. And finally, we need data itself. So what Gaia and Linda talked about are fantastic resources for new data sets. CMI itself has been putting together various data sets that have been of tremendous help to our lab in understanding different dimensions of mental health. That being said, we need more data. We need more contextual data. And so we've been building out infrastructures to both accumulate data, but connect everything from basic neuroscience all the way up to behavior. So I hope some of these things really allows us to start connecting the dots from data through an information landscape towards knowledge about ourselves and these various domains.
Great. Thank you, Satra. I want to remind the audience you're welcome to submit questions through the Q&A function. And then we have a few questions we wanted to kick off the rest of the afternoon with. And I'll put them out there. I don't know if the panel would like to raise your hand if you feel strongly about addressing it first. But this first question I'll ask plays off of something Satra just said. And so I'd invite the others to speak first to this one. So what data infrastructure are you seeing get built by government, investors, or the private sector that makes you hopeful about our ability to drive research forward on these questions? So anyone want to go first? If not, I will pick. Okay, I'm going to tag Gaia. Gaia, go ahead.
Sure. Well, Satra did talk about some of the really exciting applications that are out there now, things to be able to look at language and voice and analyze even images. I think another area that's really exciting is environmental sensors. So we do a lot of analysis of, we can look at, based on geocodes, the general area that people live and what the environment may be like. But with environmental sensors that people can actually wear, where we can actually test what's going on in their direct environment, I think we're going to get a much finer grained picture of what their experiences are that we can then tie to the other data that we're collecting. So some of those types of technologies, I think, are really going to enhance how we are able to study these conditions in the future.
Great, thanks. And Linda, I wonder if you have any experience with those types of sensors in the work you're doing.
Well, we are currently collecting EMA data with passive sensing on people's phones. You know, it's mainly about quantity of time spent. We wish there was a better process of getting more about content and context, you know, and hopefully that's something that we could improve on in the technology in the future. One thing I would like to know about, I see something hopeful happening, is that there's more bandwidth and feasibility towards understanding how to collect and share qualitative and mixed methods data, you know, to really get to at the content and context. And we know that there's all these issues of data privacy and data scrubbing and how to protect people's confidentiality, but also that there's so much richness in the vastness of all the qualitative work that's being done out there to illuminate quantitative, you know, results, and also to inform how to even create quantitative data sets in the first place. And so I'd love to see more infrastructure being built on in those fronts.
Great, thank you. Kathleen or Mike?
I would say that for me, one of the most exciting things is actually electronic medical record systems. We've seen their evolution over the last 1 to 2 decades, and governments are putting in, as well as insurance companies and varying provider systems, are putting increased focus on ensuring their rollout. I think they bring about standardization and not only helping to standardize the data that's being collected, but they're helping to make it accessible to carry out large-scale studies that not only let us look at prevalences of one diagnosis or another, but really following over time and seeing the impact with respect to long-term health outcomes. And I think that infrastructure will really let us look at society at large and understand the impact of varying early life interventions and so forth, and get a much more representative view.
So that's a really great point and very optimistic and hopeful approach. My understanding to date is that it's been very difficult to get all of those different EMR systems aligned and working in the same way. I'm wondering if anyone on the panel has thoughts about how that can be facilitated, because I think the promise to access those data are great, but the actual real life practicality has not been delivered on yet. Satra,
I could jump in.
please.
So I think what I really like where Mike was headed with that. I will broaden the concept to a personal data store. I think EMRs represent that kind of concept. It's about an individual. It allows access to different people to provide services to that individual, and it indeed becomes a rich source. The technical challenges, though, is that many of these systems were designed for billing purposes to start with, and later adapted and adopted for collecting different kinds of data that serves that individual. We have been discussing this in the context of the NIH Bridge to AI project, where we're trying to see how we can introduce, let's say, voice as a record that's collected when you do a clinical visit into your EHR or EMR. And that's challenging because there are systems in place that don't allow easy changes to some of these systems in the way we researchers might think about what kind of data we want to have available in these things. That being said, if we are talking about longitudinal data like Linda was doing earlier, it is one of the best sources of longitudinal data. It may not be controlled in the same way as a research study might like it to be, but it still is conceptually the framework around both personal data stores, longitudinal data, gathering different data types all in one place. Now, if we could take that concept and through the lens of 21st century technology, be able to refine it to reflect the kinds of things we need, we would get more data flowing for all kinds of questions, I think, in a very short term, if we could adopt the infrastructural basis to do so with that kind of concept.
Great, thank you. I'm going to give Kathleen an opportunity to also weigh in on the question, but I want to just put a pin in that and come back to sort of the privacy issues around that and allowing individuals to select how much and when they want to share their data. So go ahead, Kathleen.
Yes, one of the big issues for us is we have the opportunity to do this work in the intramural program at the National Institute of Mental Health, where we consent everybody. We ask for their permission and their participation in a study where they're involved in what we're actually collecting and what we're doing with it. I think you have to have that kind of infrastructure where you also have specific questions, because right now we have this huge environment of data where people are trying to nest hypotheses onto it. But I think what we really need to do is to collect the data with some questions in mind that will then allow us to know which domains are going to be most important for which questions. One of the things I wanted to mention was the ecological momentary assessment that we have been now building with the Child Mind Institute on the MindLogger platform, where we've had to keep adding additional modules. So with EMA, you start with the mood circumplex. But when you look at mood circumplex, then you need to know where is that person at the time they're rating their mood. So we collect data on context. Where are you now? Who are you with? Then we ask about stressors in their lives. What's going on in your life right now, which can help us to understand changes across those domains. We now also ask, we have modules for physical health. We ask about pain. We ask about sleep, motor activity, and exercise. And so by doing so, we can then take the indirect measures of accelerometry, for example, the activity watches, and we can actually validate those against true measures of sleep, physical activity, and so forth, so that when we march them out to large studies like the ABCD, we kind of have a sense of how to score those measures, how to identify the domains of interest, and most importantly, the interrelationships between the mood with these different systems, both physical health, mental health, social context, and stressors in the environment. So nesting that upon like the speech data, for example, or the GPS that can tell us where people are in terms of light, in terms of temperature, then I think having all of that together might allow us to do more in terms of the interrelationships of these systems, that we might eventually be able to identify some prognostic significance of, let's say, changes in sleep or changes in speech that might help us to identify when people are going to an episode of a disorder or having difficulty.
Thank you. Okay, so I'll move on to a next question that is somewhat related. As researchers, what is the most compelling data set that you would like to see made available for research on mental health, on youth mental health? Are there specific barriers that stand in the way of you accessing that data? And, you know, first and foremost to me is getting to know all of the time and type of activity they have on social media. So maybe we'll start with Linda, who's been looking into that specifically.
Absolutely. I think it's the content, as I said before, and the quality of content and how it impacts their well-being, because the two people could be look at the same content, have very different reactions to it, depending on what their other vulnerabilities are. Like, for instance, maybe they have a lot of social comparison issues, or maybe they have a lot of FOMO, or, you know, maybe they have a lot of social anxiety. And so understanding the kind of triggers and also things that are uplifting, you know, both sides, not just the stressors, but the things that make them feel resilient, would be a really wonderful thing to see. At least, you know, in our longitudinal study over time, it definitely started out as much more of a risk focused study, the highest risk, and trying to figure out how to really prevent harm. But over time and through a lot of participatory design of youth, like somebody was asking in the Q&A, that sometimes the questions that people are asking aren't the ones that youth want us to ask. And so we've been getting a youth advisory board to help tell us where are we, what are we missing here? You know, this is the data that we keep showing you, and they keep saying, but you're all missing the you know, our real true lived experiences. And so our study went from being primarily about risk to risk and resilience, and it keeps changing over time.
Wonderful, thank you. Mike, do you want to go next?
Sure. I think beyond social media, I would, in my mind, I would think a bit broader to the broader range of digital technologies, whether we're talking about more general digital streaming, even when you think of things like streaming of movies, whether it be Netflix, Hulu, so forth, really being able to understand patterns folks have in their digital behaviors, as well as, of course, gaming. And when you have that broader context, I think there's a lot that can be learned about trends that are emerging. I think during COVID, even just when we were using simple survey instruments, online surveys, we were able to learn about really marked increases in digital streaming, and wanting to know more about how that impacted behaviors. And until you get the broader landscape of digital technologies that are out there and get access to be able to look at usage patterns and behaviors, it's hard to put a more complete picture together. So even though there's a big focus on social media, I think we need to put the larger landscape together to see where folks' behaviors tend to you know, whether they're emphasizing one or the other, and folks who might be using one technology may be using less of the other, and then looking at how it impacts their health, essentially.
Great. So I'm going to go to Gaia because I know she has some data that speak to that from the ABCD study.
Yes, we have been collecting data, but it's primarily self-report data, but it's on all of the different ways in which youth interact with digital platforms. But unlike Linda, we're at a very high level, and she's able to go much deeper into the details of how they do that interaction. And one of the things that I would really like to see more of is analysis or collection of data and analysis of social networks, not just social media networks, but social networks and the digital space and how it relates to the social networks. And that also in real time, as we've been talking about ecologically. So our kids, what is their interaction with social media when they're together? What is it different? Does their social networks online reflect their social networks in person? I think there's a lot of really important information, particularly for this age range, that we could get if we were able to really capture that those social networks.
Do you have any ideas how best to do that?
No,
Okay.
not yet. I'm sure that there are platforms, but then we always come, and I think that I'm sure that we're going to get to this at some point today with the issue of the amount of data that you have to collect then.
Yeah.
And then once you start building, these are going to keep building out and have large amounts of data that need to be processed. And the more data of that type you get, the more issues you have with things like privacy and confidentiality, because there's more information that can be used to extract identities. So I think that there are challenges, but if we can find a way to bridge those challenges, I think it'll be really rich information.
Perfect lead in for Satra to finish up the question.
So this is a fantastic space of conversation, and I'll start with the following statement: all data are biased. And then I'm going to move on to this idea that we have been looking at social media platforms like Reddit, Rally Point, which focuses on service persons and veterans, as a source of information. Because part of this is people are volunteering that information, hence the bias, that there's perhaps a slice of the population which goes out there to put some of these. But when they go out there, especially on Reddit and subreddits that are related to mental health, they're also going out there to seek support. So there's a need for these platforms. And that's a space we have focused on over the last 5 years or so in trying to understand what we can understand about language patterns in the context of mental health in these platforms, and more specifically in the context of suicidal ideation and risk that relates to this. There are certain things, at least in the service person population, where risk is higher than the average population of suicidal ideation. And could we figure out ways in which these platforms itself can serve as sensors and guide appropriate interventions if risk could be detected through the lens of technology? So in some sense, those platforms are examples of large data sets. They already exist, they have continued use, but they have a lot of noise and variability. So I also want to kind of think about something Kathleen raised earlier. A specific hypothesis may require a specific collection of data. You may not be able to map it to an existing data set like that goes through. The second thing that I want to say is our technology has changed rapidly over the last 10 years. So even analyzing the data, and this started with Reddit, where I kept going back to the group of us who were working on it saying, was this valid in 2008? Was this valid in 2013? Was this valid in 2019? Was it valid during the pandemic? Is it going to be valid in the future? Time plays a role in this data, and we want longitudinal data, but longitudinal data has to come through the lens of all the context and other technologies surrounding it. Smartphones did not exist in 2000 and 2003.
Right.
Large language models did not exist in 2014. So we have to see this data set curation and how we use such abundant sources of data through the lens of what brought that data to be at that point in time. And this is what makes, at least for me, life very exciting. It's a challenge of how we model these systems, how we think about understanding these longitudinal streams of data, as opposed to perhaps research streams of data like ABCD, which have a more focused and specific protocol that's maintained over time that gives access to a different set of hypotheses and questions that can be asked about it. So, Michelle, I find this a very fascinating space from that standpoint.
Great. Thanks, Satra. So we have a couple of questions from the audience. I think we'll put those out there and see where the discussion goes. And if we finish them, then we can come back to the final question. So a specific one for Gaia from Linda Kakali. Happy to be doing similar work in Africa using wearable devices among youth. Have the tools being used in the ABCD study been adapted in low and middle income countries? And how does this challenge emerge with digital tools? when people get new devices every couple of years, how do we build decades-long longitudinal data?
Yeah, and that kind of follows up on what Satra was just talking about in that the technology is always changing. There have been some longitudinal studies in low and middle income countries that have tried to harmonize with ABCD data collection, and we do have all of that available if there's interest, but there's certainly some challenges. We know that the type of brain imaging we're doing, the resources are often not there for that, but there are groups that are trying to develop systems that are more easily transportable so that that kind of work can happen in low and middle income countries. With the digital technology, again, we're so reliant on access. And actually, this actually raised something that I wanted to bring up earlier, which is the health equity portion of all of this. Not everybody has access to all the same tools and resources. And so when we're looking at ways to collect this type of data, we need to make sure that we're collecting data from everyone. And that often can be biased based on what kind of information. Electronic health records is a good example. Not everybody has a primary care physician that they see every year. They may only get their care from emergency rooms. So we need to make sure that we're collecting all of those different types of information from all of the people that we want to serve. So I think I went off in a little bit of a tangent there.
That's great.
But I think it's all related with that health equity lens.
Yeah. And Mike, do you want to add on that about the low and middle income countries?
Well, I think that's something that at Child Mind Institute we have actually we're actively working on through a global center, the Stavros Niarchos Foundation's global center, Child Mind Institute. We are working to use smartphone technologies as well as wearable sensors as mediums by which we can work to study behavior in low-income countries and try to also work towards identifying those uniform signals that can be obtained. Though again, you have to adapt to any given environment, especially when you talk about sensors, because if you provide someone with a sensor, you could actually, depending on the environment they're living in, be creating a danger for them as far as someone trying to take that sensor from them. And but it really is a unique opportunity to measure biological, physiologic signals and really look for variations within and across cultures. And I think the technologies are really helping us take that step forward. And then even to your point with imaging, I think now I know we have one study that's launched recently in South Africa, really trying to put more of a focus on understanding brain development in low-income countries, and also the Brazilian high-risk cohort that the director of our global programs helped start over a decade and a half ago, has also had that focus, where I do think neuroscience needs to have a more representative approach. And I think from one hand, we can do that increasingly with brain imaging and so forth. But to your point, it's expensive, it's challenging. These digital technologies are going to really make it where we could bring greater representativeness and equity to medical research.
Great, thank you. Kathleen?
To say that the ecological momentary assessment that we're developing in conjunction with the Child Mind Institute is now being translated into several languages. We've already translated it into Korean, and now we're working with Portuguese. It's been translated into French. So this is something that would be readily available in other countries. We're now trying to move into 2 African countries who are French speaking. So I think making this available to people, it's not easy to be done because of the cross translation that one must do, and also the target group, the age group, what social media are they allowed to get in their countries and so forth. But I think it is a start to be able to make these different apps available to people, that we will then have some norms and collect the data and put it together. So I think that would be really nice to do, maybe in conjunction with ABCD and one of the follow-ups that you're doing, where we could collect the same kind of data across different countries.
Great. Thank you. So now a question for Linda from Madeline McGee. The Youth Media and Wellbeing Research Lab has a youth advisory board. I'm curious if you've heard from youth themselves about these methodological challenges and the role of participatory methods might be in devising innovation systems of measurement.
Yes, I'm so glad that somebody noticed that I'd be having an advisory board, which I really recommend to all research studies. One way that the Youth Advisory Board has been so key has been in the interpretation of our data. Like there's not just one way of looking at the same exact, finding, like maybe, for instance, a finding of, oh, youth are becoming more and more realizing that they can't get off of social media. And so everybody's like thinking, adults might think, okay, here, raise the alarm, they can't get off social media. But then the youth will be like, wow, look how much self-awareness we have, that we have these issues. And with awareness means that you can actually address it and maybe put some boundaries on it. They actually realize that they need boundaries. And so the way that we interpret it is so much a part of the whole point of the research in of it itself. I mean, so much of the quantitative research, at least, the big data, sometimes it's about, having this general, recommendation for a general average, adolescent. And it's really nice to have the Youth Advisory Board to be able to kind of break down what it is. How does this relate to my life? How does it relate to my peers? Does this ring true? Does this feel authentic? And for us to really kind of tweak some of those measures from time to time, since it is longitudinal, there are opportunities to kind of keep going and looking at the lens that we're asking these questions. Is it a protectionist lens that we know what's best for you versus an empowerment lens where, maybe there's some agency that the youth might come to bring to this?
Wonderful. Yes. So we're hoping that this will be the topic of a future webinar in this series. So stay tuned, everybody. And I want to offer the opportunity for anyone else on the panel to weigh in on that. Mike, you may have some.
Sorry.
Okay, go ahead. Go ahead, Guy.
No, I totally agree with what Linda just said. And I think one of the things that we're finding also is that there's a big generation gap. I mean, it seems even bigger than the years would suggest, because technology is moving so fast, because the world in which they're living in is moving so fast, that I feel like we as researchers really need their input, because we do not understand the world that they're growing up in. Without that information, we're going to miss the boat, like Linda was saying, in terms of asking the right questions, even, and asking them in a way that we're going to get the information we actually want. So yeah, totally agree with Linda.
One thing I would say is, I think a challenge as we move to, for example, when you think of smartphones and trying to collect data in an active fashion where you're probing a person for questions, what's happening is teenagers are reporting that they feel overwhelmed by the amount of notifications they get, and they have all these varying forces competing for their attention. So now we, the researchers, are stepping into that mix. And so first of all, we might inherently fail by fact that there's already so much competing for their attention, but also if we don't design our approaches to really accommodate their needs, to be brief, to be easily accessible, and also be salient, that can be challenging as far as the viability of more active approaches. The alternative is greater reliance on passive sensors and passive sensing, which has a lot of appeal, but can also have limitations, and also can increase the number of ethical questions that can arise. So we're really having to find that balance of working with youth to figure out how to most efficiently and effectively engage them, as well as how to balance the amount of information we're getting with what is practical and healthy to be getting.
Another question from the audience. Are any of you trying to use this data to determine what medications are working for which mental health conditions? Prescribing medication is very hit or miss now, and using big data could help inform medication management. It's from Megan Harris.
I could say that right now, what we're working on as part of our next generation digital therapeutics program is a focus on developing response monitoring tools. So right now we're developing them a bit more broadly, but a key question does become about medication response. And this is, again, where technologies offer unique opportunities, because for example, when you think of stimulants, where the response you get to a stimulant will vary over the course of a day as the medication begins to wear off. With the digital technology, especially if you could do passive sensing, you might be able to pick up physiologic signals that will signal this is when the medication is dropping, and then look to see what are the ramifications on behaviors observed, and really work to optimize. So that is something that I think as a field, it really is a goal. And I think that technology is offering us an opportunity to get there more rapidly.
Great, thank
I
you.
can just say quickly, we're doing this in studies of children with headache, where we monitor whether they took their medication and also whether they're adhering to our behavioral programs, where we instruct them to drink a certain amount of water and eat across the day. So that, yes, I think that is the vision for many of us, that once they're tailored to individual disorders or individuals themselves, that we'll be able to use them to monitor compliance and remind them of different things that they need to do.
Great. So I have a question for Satra from Gregory Lomack. Satra mentioned moving from neuroscience to behavior. What data collection would support the documentation of this movement?
Great question. I think it's the challenge right now is going from that micro scale of the cells, the circuits, all the way to how they might express behavior or lead to behavior. And that's going to be a challenge. I think I'll be dead and gone before that's actually addressed. But I think one of the things that we are putting together are these connections. There's a significant amount of effort from the NIH Brain Initiative right now to map across scales, across circuits, and connecting brain circuits and cells to behavior. So over the next 5 years, I think you're going to see a lot of data sets and other things coming into the picture that monitors snapshots of this for different populations. The scale is going to be a little bit more challenging. Not everything can be monitored in an individual, both at the neural level and the behavioral level easily. We're going to see much more behavioral data coming online, and that's going to be helpful in a lot of contexts, both in youth and across lifespan. And that's going to be the easier space. The connection to neural data is going to be a lot more challenging. In fact, most of our highly cellular stuff is done either in animal studies or in ex vivo, so people who have passed away.
Yeah.
So we're looking at both technology that does not quite exist today to span that gap that you're asking for.
And do you feel the field of neuroscience has gotten better at integrating those different lenses? So folks who focus on the cellular, molecular circuitry, et cetera, are they listening to the studies that are being published and talked about on the behavioral end, or are they still siloed and focusing only on their keen interest?
So I would say better, yes, a long way to go. And I think there are some silos that are breaking, and some people who are looking at cells and circuits are looking at diseases like Alzheimer's, Parkinson's. So there's some connection, and that's where some of the behavioral stuff is slowly coming in. Across the space of disorders and mental health, I don't think so yet. Our understanding is quite limited at this point in time. But that being said, I think we're looking at different scales, right? So many of us have done work in the brain imaging space, which is somewhere in between. It's not at the cellular level. Guy was talking about ABCD, a perfect example of a data set that focuses on brain imaging associated with behavioral, but that behavior is largely static. And those are some of the dynamics that we hope will change as these tools and technologies that Kathleen was describing, Linda was describing, kind of couple in with those more reduced sampled brain images that exist. And who knows, maybe we will have a machine at some point in time where we, just like we wash our hair, collect brain imaging data at home at some point in time in the future.
Yeah, I was going to say the same thing, that, it's great we can do tasks in the lab and they can do tasks in the scanner, but that's not what they're out like when they're out in the wild. Right. So if we want to understand the what's going on in the brain when they're actually in their environments, we're going to need a great leap in technology.
Okay, great. So we are at 3 minutes before the hour. I want to give Kathleen, Mike, and Linda each a minute to just sort of give their last bit towards the end of this wonderful, wonderful webinar. And I want to thank everybody up front. So let's start with Kathleen, go to Mike, and then Linda.
Okay, well, what I'd like to say is I think that we're really in an era where we can start to harness these tools to help us understand children and adults in their natural environment. So I think what it's going to require are panels like this and larger groups who work together to identify what are the most important domains, so we don't waste a lot of people's effort collecting a lot of data that never gets used. So I think as we move forward, I think it is going to take a big effort of us to think in advance about the ethics, to include the target samples and the populations to give us information about how intrusive it is. And the ethics are going to be a very big issue, which I believe we're going to be discussing on a
In
future.
another, yep, absolutely. Thank you, Kathleen. And now Mike?
Okay. It's just picking up on what Satra said earlier, some of the advances in really linking neuroscience to behavior are so dependent upon the interdisciplinary nature of research. And we are seeing growing collaborations between the differing scales, which that's heavily driven by initiatives like the BRAIN Initiative that actively promoted multi-scale research. The same way that we've seen that as we step into real world data, we're going to need to see more collaboration between academics, industry, families, policymakers, really to help provide the necessary range of knowledge and expertise in order to move the field forward.
Great. And Linda, last word from you.
Yes, and I saw in the Q&A somebody asked about actionable strategies, and I would dare say that maybe we can even use ecological, sampling to understand if the strategies that we're trying to help young people with their social media use are working. Like I have a digital well-being workshop, for instance, that have free for families, and every day we ask, is this what's going to help you? Is this helping you move forward, understanding self-awareness, other awareness? And so hopefully we can get on the right track.
Great. So again, I want to extend my thanks to all of the panel members and the audience who've stuck with us for the full hour, and look forward to hopefully seeing you on some of the future webinars. And I want to remind you that this recording will be made available, as well as questions and the responses to the questions. So thanks again for your attention.